Hey everybody, I'm Dan, back again. We got Dr. Bilski here.
Good morning.
Morning, how are you?
Good.
Good. So, all I heard you say was something about grafting and bone, and it just sounds like that hurts. What's our topic?
This is bone grafting for dental implants.
Okay.
Or maybe you don't want a dental implant, but you want a bridge.
Okay.
So if you have a hole in your jaw, we need to fill a hole. Like in construction. If you dig a hole, by the end of the day, it either needs to be covered or filled.
Mm-hmm.
So that maybe put a post in it, maybe put a tree in it, a shrub, or just fill it back in.
I want to know, how do people even get this hole in the first place?
A couple good ways to get a hole. Don't brush your teeth, get a cavity, can't fix it.
Okay.
We have to take the tooth out.
Gotcha.
All right. If you are somebody that's predisposed to gum disease, so it's called periodontal disease, and you lose bone and the tooth is loose, we have to take the tooth out. There's a hole. Okay?
I gotcha.
A lot of different ways. For this interview purpose, we'll talk about a couple. If you have a natural tooth that's loose, not savable, we have to take it out.
Mm-hmm.
We can actually remove the tooth, and in a machine, we actually grind it, and I call it the Mr. Coffee machine. If anybody understands that, grinds it up.
I understand that.
Turns it into a little particle.
Yeah.
And then in our practice, we have two gals, Cassie and Alexis, that are phlebotomists. That's somebody that draws blood, like when you're in the hospital or at the doctor's office, the nurse comes in, or a person that's trained just to draw blood. And they come in, and we use your own blood products. They're the bone morphogenic proteins that we use to mix with that ground up tooth. Mm-hmm. And we pack it in there. So it's kind of Frankenstein-like, but it's with your own stuff.
Yeah.
Another alternative.
That's kind of interesting that you're using their own material, so to speak.
It's very well received because it takes out this is a cadaver bone crystal, which, we can go a little bit more into. I have cadaver bone crystal. I had my neck fused due to an injury.
Okay.
They took bone from a cadaver, placed it in there, and what the body does is actually dissolves it. That's not the right term, but resorbs it, eats it up, and then replaces it with your own natural bone.
Huh. Wow.
Both principles.
That's crazy.
Both principles. Cool. A ground up tooth is very similar in composition to bone, and actually it takes a little longer. It's called turnover, which a lot of times we want longer turnover rates. Mm-hmm. And then we can time it up however quickly you want to do it. So it's a nice Dancar bone, if you will. We take a tooth out, grind your tooth, spackle.
Okay.
Put it in there, a couple stitches, you're on the road. Typically in the lower jaw, it's about 3 months, upper jaw about 4 months.
Okay.
Sometimes a little quicker depending on your health.
Okay.
Or what procedure we're moving forward with.
How long does the actual procedure take place?
Again, we always gear things to about 90 minutes, about 10, 15 minutes to prepare the blood draw.
Right.
We take the tooth out. That takes 13 minutes.
So let's talk about blood draw for a second. A lot of people, I have 6 kids, you have 5.
Yeah.
I've seen people get a little wheezy over the blood draw. How does that, what's the percentage of people, or how do you guys handle that if somebody's kind of nervous about that part?
I have to tell you that a lot of patients have white coat syndrome. Mm-hmm. In our office, we have Alexis and Cassie. They're these darling little cutie pies that work for me. I know that's probably not politically correct to say it that way, but
describes it.
They're unassuming. They come in. They're so nice and soft spoken.
Yeah.
I guess compared to me walking in, I'm a little wider and bigger than most guys, and it's scary.
Yeah. You would scare me, actually.
Yeah, and usually...
Not really. Well, once you get to know Dr. Bilski, he's fantastic, so...
That being said, usually people are afraid to be in the dental practice, and they just come out and they say, I'm afraid of needles, I can't draw blood. I totally understand.
Yeah.
We don't do it on everybody.
Right.
But most of the time, the patients that we have coming in, we have a true relation. We're not just trying to run through our day and get this done. Yeah. It's like, talk to me, tell me what you are bothered by. Yeah. Or the girls, they do the same thing. And rarely do I have anybody that says
no.
Right. It just makes sense. Like, oh, okay, Cassie's going to do it, or Alexis is going to do it. Oh, okay, they're so nice. I've had them do other things for me.
Yeah.
go ahead and do it.
Yeah. There you go.
Yeah.
So we covered quite a bit in there. Anything you want to tell our patients and what they need to know to get this procedure? It's simple as a phone call, right? Just
a quick phone call. If you're concerned about a tooth that needs to be removed, and you've already been told to have a bone graft along with your dental implant or your bridge, it's as simple as a phone call, and we can go over the procedures. It's on our website. It's called PRF and PRP. Explanation. We have tons of pictures, not of the graphic procedure, but we have the before and afters that you can see, and very confident in results.
So I'll leave it at this. We're going a little bit long, but what if they don't know they have a hole? Is this something you guys identify, or do they usually know they have this problem?
No, that's a good point. I call myself Mr. Analogy Man. You've heard of people that exercise and don't drink, don't smoke, they eat right, and they go in and their doctor says you have a heart condition.
Yep.
But they feel great.
Yeah.
And either they caught it at the right time.
Gotcha.
Or they didn't.
So this is similar to that idea.
So you come in, and we have patients all the time they're called abscesses, and abscesses can turn into cysts, which can turn into tumors. Doesn't happen often, but that is the normal bone physiology and what happens if you don't take care of it.
Right.
So go to the doctor, take an x-ray. Yeah. Then we see it.
Yeah.
Does that hurt? Doesn't hurt. Okay, let's schedule this.
Right.
Or if it's really, really, really bad and painful, different story. We take it out, antibiotics.
Gotcha. So it's either pain or they don't see it. Your team can identify, let you guys know about that. Or if you already know about it, feel free to call the office and have it taken care of. Thank you guys.